Hello and welcome to Right Parenting Tips. Today's topic is accidental injuries in children, which will help you to be aware of common accidents waiting to happen inside and outside your home. According to U.S. Center of Disease Control statistics, accidental injuries is the leading cause of death in children over the age of 1 year, and the fifth leading cause of death under the age of 1 year. Among the accidental deaths, suffocation or choking is the commonest cause under the age of 1 year. Between the age of 1 to 4 years, it is drowning, and between 15 to 19 years, road traffic accidents. So, why is there such risk for child safety? It is because children are physically and mentally immature, curious to explore and experiment, have no practical sense of danger and self-preservation. They are often dependent on adults for supervision. Suffocation or choking is the commonest accidental cause of death under the age of 1 year. It causes asphyxiation or cutting down of oxygenation to brain and body systems. The baby can suffocate while sleeping if lying on the tummy or by getting trapped in the loose mattress, pillow, beddings, blankets, soft toys, or other objects kept in the bed. Use of soft mattress, pillows or comforters, and bed sharing with adults increases the baby's risk of such accidental suffocation. Choking on small objects such as coins, beads or toy parts, on hard foods such as nuts or candies, on sticky or big food boluses, or on vomited food are common accidents in early years. Accidental suffocation can happen during role play with plastic bags over the head, or strangulation by curtain strings or ropes. Falls are common causes of accidental injuries in children. They can lead to all sorts of injuries, minor or major, superficial or deep, external or internal, and soft tissue or bony. Outside home, falls happen during rides, slides or skateboarding. They can also happen during running, jumping or climbing during playground or play area activities. It is often overlooked that many serious falls can take place at home from balconies, windows, stairs, cribs, cots, high chairs and not to forget, from baby walkers. Wet floor is also an important cause of falls. Drowning is the most common cause of accidental death for 1 to 4-year-old children. Majority of drownings in this age group take place in domestic swimming pools. Young children can drown in hardly 2 inches or 6 centimeters of water. So such drownings can happen in bucket, bathtub, toilet bowl, kitchen sink, inflatable pool or any water reservoir. In older children and adolescents, there are more chances of drowning in natural water bodies. Lack of adult supervision, lack of safety barriers, lack of swimming ability and non-use of safety equipment are major risk factors. Burns are common accidental injuries in children, that can occur from exposure to heat from fire, steam, hot liquids and hot surfaces. They can also occur after exposure to chemicals like strong acids, radiation, sunlight or electricity. Depending on the depth of injury, they are classified into first, second, and third-degree burns. In toddlers and children, heat-related burns from scalding and flames are more common. 75% cases of scalding burns in children are preventable. Playing with fire in kitchen, fireplace, barbecue pit or campfires or playing with matchsticks, cigarette lighters or firecrackers are risk factors for flame-related burns. Burns in kitchen can also happen from dipping hot foods, liquids or contact with hot vessels. Hot water in bathtubs or taps causes most of the hospitalizations and deaths in scalding burn cases. Poisoning is an important safety hazard in children. 13% of overall global accidental poisonings happen in children and young adults. Young children, curious to explore with all senses, often ingest poisonous substances. Their smaller weights and immature physiology make them more susceptible to toxicity of poisons. Adolescents often fall prey to peer pressure and risk-taking, leading to poisoning with alcohol or drugs. Over-the-counter medicines, prescription medicines, household chemicals such as bleach, kerosene, detergents, cleaning agents, disinfectants or cosmetics, pesticides, poisonous plants and bites of animals or insects are the major causes of childhood poisonings. Road traffic accidents are common causes of accidental injuries in children. In fact, according to CDC, it is the leading cause of accidental deaths in 15 to 19 years age group. Some peculiar factors make children more susceptible for road traffic accidental injuries. Their small stature makes it difficult for them to see the surrounding traffic, and also, makes it difficult for drivers and others to see them. Immature physical, cognitive and social development, tendency for impulsivity, and lack of focus make children more likely to miss the impending traffic dangers. Their softer skulls make serious head injuries more likely. Risk-taking behavior in adolescents compromises their safety in traffic. Sharp object injuries are uncommon but serious accidental injuries. Children can accidentally hurt themselves by sharp objects like knives, scissors, razor blades, sharp furniture edges or broken glass. This can lead to minor or major injuries. Electrical injuries are uncommon but can lead to significant morbidity and mortality. Contact with open accessible electric points, live wires, or faulty appliances, and lightning strikes can cause such injuries in children, which can lead to burns or even heart rhythm disturbances, including cardiac arrest. Furniture toppling or tip-over is an often overlooked but serious accidental injury in children. Freestanding furniture like drawer chests, cupboards, bookcases, mirrors and television are often unstable and can topple and injure children, especially those under the age of 10 years. Such accidents can lead to cuts, wounds, fractures, dislocations, crush injury and internal injuries including head injury. They can even lead to death because of asphyxiation.